Dedicated to improving the lives of at-risk patients worldwide, FlowAid Advanced Medical Systems has drawn together a core group of renowned medical experts from around the globe with one chief objective: to address the complications arising from inadequate blood flow, atrophy, and paresthesia. The results? FlowAid FA100. FlowAid's FA100 with muscle pump activation technology works internally with the body. Unlike external compression devices, the FA100 naturally supports the body's circulatory system through the venous muscle pump. Increasing local blood flow and temperature in the lower extremities accelerates wound healing, dramatically improves symptoms of lymphedema, and may completely avert the need for amputation. The venous muscle pump is an integral element of the circulatory system. As the body moves, the calf muscles contract and release, putting pressure on the veins and forcing the blood to rise through the venous valves toward the heart. The problem begins when injury or chronic diseases cause patient inactivity. Inactivity sets off a vicious cycle of poor blood circulation, pain, more restricted movement, muscle pump failure, less circulation, and more pain. As the patient becomes less and less active, the circulatory system is compromised. Blood flow to the lower extremities declines, valves weaken, and oxygen and nutrient supplies become depleted. Wound healing slows to a crawl, often leading to gangrene with eventual amputation the only solution. FlowAid's FA100 works with the body to support and encourage the circulatory system in both ambulatory and non-ambulatory patients. Treatments are painless and put no external pressure on the tissue. Using a closed circuit of 4 separate wave pulses, it naturally stimulates the activation of the muscle pump. By initiating contraction of the calf muscles, the FA100 assists the natural mechanisms that regulate and control the arterial blood flow and venous return through the following 4 actions. Action 1. The primary action is the activation of the venous muscle pump. Regenerating increased blood flow activity in the lower extremities initiates a positive chain of events that leads to accelerated wound healing and dramatic improvement in lymphatic drainage. Action 2. The FA100 initiates a peristaltic wave contraction. The wave moves along the longitudinal axis from distal to proximal. As the muscle puts continual pressure on the vein, deoxygenated blood is forced upwards through the venous valve chambers, preventing venous reflux. Action 3. Active muscle tissue burns through oxygen and nutrients at a higher metabolic rate than do muscles at rest. The enhanced burn rate intensifies blood diffusion through the arterial walls and speeds the manufacture and delivery of nutrients, improving metabolism and increasing arterial blood flow. Action 4. Chronic activation of the musculature builds muscle mass and stimulates angiogenesis, the formation of new blood vessels and bypasses. Increased muscle tissue exerts constant pressure on the vein and prevents vein laxity. FlowAid's FA100 with muscle pump activation technology improves local blood flow, raises temperatures, accelerates wound healing, improves lymphedema symptoms, and increases patient mobility. FlowAid's FA100 assists in the treatment of diabetic circulatory complications, peripheral vascular disease, prevention of deep vein thrombosis, Raynaud's syndrome, and lymphedema. FlowAid Advanced Medical Systems. Saving limbs, saving lives. Since its introduction, the FA100 has been used and tested on hundreds of patients internationally. The following case studies represent typical results in 3 measured areas of improvement: temperature increase, wound healing, and blood flow velocity. Sample 1. Temperature increase. The patient was male, 64 years of age, diagnosed with type 2 diabetes, painful ischemic, diabetic neuropathy, and severe peripheral vascular disease. He was treated with FlowAid's FA100. Results showed temperature increases of 19 degrees to 34 degrees Celsius during 150 minutes of treatment, and noted improvement in maximum walking distance post-treatment. Sample 2. Wound healing. The patient was male, 72 years of age, with a chronic heel ulcer due to previously sustained vascular injury. He was treated with the FA100 over 9 weeks. The results were full recovery and healing of the wound. Sample 3. Blood velocity. The patient was male, 54 years of age, diagnosed with severe neurological disorders, peripheral arterial disease, and damage to the motor system due to stroke. The patient was treated with the FA100 1 hour, twice daily for 3 weeks. Results showed an improvement in blood velocity of 72.5% during 95 minutes of treatment, as confirmed by laser Doppler flowmetry.